right? Like maybe a horse that has some arthritis can't jump 3 foot anymore, but they can jump, you know, 1.5 foot. You know, like sometimes we just decrease a little bit, or maybe they were in a 7-day-a-week program, let's bring them down to 4 or 5. You know, sometimes that alone can help a little bit because it just gives their body a little bit more time to rest, or just do a little bit less hard of a job. It might involve modifying the environment. So an example there would be a senior horse who's living on a steep hill, and they're kind of struggling with that. If you put them on a, not necessarily a smaller space, but a flatter space, that might help. Or if the footing is just consistently poor. I just had a whole dressage barn, leave one barn because I didn't like the indoor and moved to a different one because the footing was just consistently poor. And you can imagine trying to do dressage work on that's not great, so modifying the environment can help. There's tons of physical modalities that we can do. Massage would be, you know, a physical modality. Chiropractic, acupuncture, we'll throw that in there. Those types of things can help some horses quite a bit, mainly because of improving the mobility, right? Chiropractic is taking a joint that we call them subluxation, but instead of this joint being a normal alignment, it is rotated a little bit one way or the other, and it decreases the joint's normal range of motion. So in chiropractic, you're going to do a specific adjustment on that joint to try to reintroduce the normal motion, right? You hear people calling chiropractic as the joint was like out. It's not truly out. Like we're talking millimeters or less of true difference on the change, but it's one that doesn't seem to respond to motion. Like I'll come through on chiropractic and I'm standing above the horse and I'll kind of press on the top of these spines, and I just want to feel just a little bounce, a little give. I want it to feel like I'm pushing on something alive and not a 2x4. And if it feels like it doesn't want to move, again, that's that adjustment to kind of say, hey, let's reintroduce that normal range of motion. But again, massage can do similar things if you have chronic lameness in your elbow and you stop using that full range of motion. Your tendons and your muscles start to get sore and a little constricted. So massage can improve, again, the range of motion, the suppleness, the mobility of that area. Acupuncture is going to work a little differently since it's not so much, you know, physically manipulating the area, but putting that needle in, mainly it's affecting the nerves, the blood supply, the connective tissue, all in that area. Sometimes it can help with like trigger points and spasms that are going on there and kind of relax that. Sometimes it can also help with the chronic pain pathway and interrupt that. That kind of like a death spiral of like, it hurts a little bit, so it's sending signals to my brain that it kind of hurts, and so then we, you know, we protect a little more, and then we move it less, and it hurts a little more, and it kind of just cycles that way. So you put that needle in there, and suddenly you're sending a different nerve stimulation to the brain, and you can kind of interrupt that pathway to a certain degree. Other things that we can do, like a little more tech, like high tech, would be our shockwave treatment. Shockwave, I like it for a lot of different things, especially when I think I have a joint, soft tissue, muscle component kind of all wrapped into one. Because, you know, if I just stick a needle in here, I haven't done anything for the ligament nearby or the muscle nearby, versus if I do shockwave, I'm kind of treating the joint itself and I'm treating all those structures around it, so you can combine those things too. But shockwave is sending a high energy sound wave into the tissue. It was originally developed actually to dissolve like kidney stones by sending shockwave or like even bladder stones. And they realized on humans, hey, the bone density is better after we've done the shockwave treatment, like in their pelvis, right? So like, okay, it's got some effect on bone too, and then that's kind of where these other applications have come from. But most of our treatment modalities are trying to do the same thing. Let's improve circulation, because circulation is the key to getting toxins and these like pro-inflammatory things kind of flushed out, bringing in new oxygen, new nutrients, so like more healing factors into the area, keeping things from being stagnated. And as we know, so horses' muscles stop at about this level. Everything here down is not really muscle, it's ligaments and tendons. Those have they're more avascular structures. They just have poor blood supply. That's why if you get a wound down here, it's much more likely to take a long time to heal than if I have a wound up here that's over muscle, because muscle is full of blood, right? So often, now they have, of course, have blood vessels that come down here, right? But they're not like permeating all of the tissues as well. So a lot of what we're trying to do with all of our treatment is get more blood supply. Like blood is that's our lifeblood, right? Like that's what saves us. So Shockwave does a lot of that. Shockwave can also help sometimes an area that's kind of stagnating on its healing, kind of wakes the body up to the problem and kind of, just almost cause that physical change to say, hey, like alert to this area, let's bring in some good cells here, let's do some help treating it. And it also tends to be pain relieving, at least in the short term. And another one that we like a lot is like the laser or the light therapies. There's different versions. From the red light spectrum, which is kind of on the low energy level, up to the class 4 laser, which is what we have. Then there's a few different class 3 lasers, 3A, 3B, that are kind of in the middle somewhere. All of them do good things. It's just a matter of how effectively they can apply it. And again, class 4 laser, that's healing with light, called photobiomodulation, increasing blood supply. It also can help increase the energy, the ATP production within the cell itself, so have more energy rather than the ATP depletion stage. Almost like photosynthesis. I know we don't photosynthesize, but it's kind of that same way. It kind of activates the mitochondria. And it just encourages more oxygen exchange at the level of the tissue, and oxygen is great for healing. So that's that. Another physical modality would be like PEMF, the pulsed electromagnetic field. We have something called the beamer, which is a type of PEMF waveform, but then there's MagnaWave and a Sissy loop and probably a dozen others that I don't know all the names of. That works more on like the action potentials of the cells, but again, trying to improve beamer especially does a great job at improving circulation in the capillaries. So the ones where it's like only one red blood cell can fit at a time, it'll increase the speed at which blood is flowing through those capillaries by like 30 times. It's crazy, and it'll last for hours after the treatment's done. So yeah, things like that. And then stretching and conditioning are things that can help as well. So I might dive into a little bit on specifics of what we can inject into joints, but just first, a few more prevention recommendations. So we talked a little bit about oral supplements. Again, I have no problem doing them. The more you spend, probably the better it does. But other things you can do, especially early on, like in young foals, weanlings, is make sure they have good, adequate nutrition. We have to be careful that we don't overfeed them, especially with grain, but they can grow too fast and actually cause some damage that way. It's mainly balance, and there's people who dedicate much more of their lives to studying all the intricacies of nutrition, but like zinc and copper balance and things like that can be really important with how joints and cartilage form. Even going back as far as what the mare is eating can be affected. But for the most part, if you just have a well-balanced diet plus a little pasture, you're probably doing better. Versus if you have your foal in a box stall and you're feeding it lots of grain because it's a halter horse, that's probably not best for its long-term joint health. Other things that are important to do at a young age is correct those deformities. So if they have a little bit of a crooked leg, we call that varus, pigeon toe, a little varus. You can either do a little bit of corrective trimming with a farrier to try to change how their hoof is, to kind of straighten their leg out, or there's certain surgeries we can do to try to get that leg straightened. Really commonly done in racehorses. They want their legs straight, not turned out. So they might do different surgeries to change the way the growth plate, the acceleration of the growth plate, to try to either speed up or slow down the side to get it more straight. You can do sometimes you might have a contracted joint on a young horse. It might lead to something mild like a clubfoot, or those ones that really can't straighten their leg all the way, and those are really severe. If you can't fix that early on with hoof care, sometimes we can do a surgery where we like cut a tendon and release it so their leg straightens out more, so it's a little bit more advanced. But in all of those cases, you have a window of time where the foal is growing and those growth plates are open that you can affect change. Once they get to 2 years old, most of those have closed, and you've kind of lost the window on correcting crooked legs. But then other things, prompt treatment of injuries. A puncture wound is a classic example, like let's make sure it's not infected, let's figure that out on day 1, not day 7 or 14. But maybe it's just blunt trauma, and they don't really have an infection in the joint, but they've aggravated the whole area. Like, let's not let that go 6 months before we try to tackle something. Let's do something on the earlier side. And then just encouraging strength, flexibility. I love cross training, so you're not always in the same type of pattern all the time. Proper shoeing is really key, and we can spend a whole day going into that. But things like negative plantar angles, or imbalance of the hoof inside to outside, right? Maybe your farriers just trim them a little off, or maybe your horse likes to wear one side more and it kind of puts them out of balance. Again, we talked about clubfoot. Breakover's another one. These thoroughbreds are great. They like to grow really long toes that stick out way in front of them, and now they have kind of like a clown shoe that they've got to bend over. Keeping that toe shorter, which we call breakover, will help put less strain as they're crossing over and walking. Other things we'll do are anti-inflammatories. That could be as simple as ice, right? As an anti-inflammatory, or your liniments or your poultice that you can put on after a ride. Certain compression boots, magnetic style boots, or ice wraps, many different things like that to try to calm down inflammation like immediately post a hard exercise. We talk about supplements a little bit, which I do think joint supplements, especially oral joint supplements, are probably going to do better at preventing change, preventing arthritis, than again treating what we have. But getting them on something younger is better than waiting till they're 15 to start, you know. So that's kind of the main thing on prevention. And then just to know a few more advanced things that we can do that typically aren't done as much in our practice, but they're there. We've got more advanced imaging like CT and MRI. Sometimes that'll find more subtle lesions earlier or really help you decide, is there a soft tissue component here or not? So we're doing more and more CTs and MRIs of horses. There's also something called PET scan, which is like a functional MRI, which is, first one is at UC Davis, but they're starting to spread a little bit, and that can sometimes give you indications of something's going wrong. There's also ways to do objective gait analysis. So instead of my blind eyes looking at your horse goes, you can hook a computer up to them. Lameness locator is like the classic example, and that can give you like objective numbers that's kind of evaluated by a computer program to decide if their gait seems symmetrical or asymmetrical, and it can help you out there. Or especially if you have really complicated like multi-limb lamenesses that you're trying to figure out, it can really help you sort that out. Nowadays, there's getting to be more AI in programs, either reading radiology images or like interpreting the objective gait analysis stuff. So we'll see more and more of AI getting in here, I'm sure. And then I guess that's the rest of it. I was going to see where our time was, because the last thing we could talk about, it's 4:15, is all the different things that we can inject into joints. So I'll leave it there, and if you guys have specific questions or want to go into that, we can do that. And Nancy, I'm happy to.
On the oral supplements,
yes.
Is there a particular ingredient you should be looking for?
Oh, another excellent question. So the old standbys are glucosamine, chondroitin, and MSM. Like, we've known that for a long time. Now there's dozens more that are probably good. There's the ASUs that come from like avocados, something that are good. There's things that come from, there's some like porcine products that come from pigs that have been shown to be fairly good. And then you've got, even now, I was just at a lunch with Platinum recently, and in their joint formula, they have recently added tamarind root and the turmeric. So people have been like asking me about turmeric for a long time, and there's been good data to say it's anti-inflammatory for a long time, but getting to a point where it's going in some of these oral supplements. So there's probably many more, and as we talked about earlier, I'm not the best at knowing all of those things in
with dogs, I know that there are like 4 brands of food that are research backed.
Sure.
Is there something like that
On the
for
supplement side?
supplements? Yeah.
Yeah, the ones I'm usually gonna direct people to because of the research, Platinum Performance, they've been in the business for 30 years and they've been doing good research for 30 years and making sure that their ingredients are actually doing what they say. They also do a good job of making sure they won't test for any banned substances if you're showing. So that's why you'll see a lot of like FEI level horses on Platinum. I think SmartPack in general has done a good job at researching things and they have a lot of good options. Cosequin, made by Nutrimat, I can't remember who makes it, but Cosequin has been well researched over time and been around for a long time. Those are usually the first 3 that I say because I know that they've got a good track record. I believe in the quality that comes out and the research. You can also just look for something on your supplement called NASC, which is like North American Supplement something that like they can get that stamp or that badge of approval by like following certain quality control things. So, you know, it doesn't necessarily, like supplements, as you know, are not FDA proven to be effective, but they do typically have to go through some safety testing or regulations. Yeah, Blue Bonnet, which I'm hoping to get Lindsay from Blue Bonnet to come do one of these talks for you. Talk to Nancy about dates, but she's somebody who just knows so much about supplements and stuff. Blue Bonnet has some of the more cutting edge research in their feed products on joint stuff too. Theirs aren't so much supplements; those are more like whole horse feed for the most part. Although they do have some specific products out there too. I'm not 100% familiar with their line, but I know they have like PhD nutritionists that work with them and do a pretty good job on the research side. Yeah.
I've seen something about like silicate-based osteoarthritis. I'm like reading some papers for a project. What is that? Like, is that familiar?
Yeah, so a lot of times the silicate-based products, as far as I understand, are mainly really good at your bone soft tissue interface, which is a fairly significant source of pain. Osteomax, I think, is an example that's more like silicate-based. Osteon from Platinum is more silicate-based. There's probably more details on that. I'm not gonna
Okay.
say something wrong.
I'm talking about like it was like breathing in, horses breathing in silicates can cause some kind of arthritis.
Oh, I see
Yeah.
what you mean. Like,
Yeah.
so,
Or not silicates, but breathing something in them.
no comment. I don't know enough about
That's
it.
okay. It was a UC Davis article, so it's only
Yes.
opinion.
Yeah. Sweet.
Yep.
Well, if there's anything else, let me know. And yeah, it'd be like a whole other hour to go into as much detail on the things we can inject into joints. But broad category, we have the steroid version, right? Anti-inflammatory talked about. Then we've got biologics, which are things we draw from the horse's own blood. That's an example of some of that more cutting edge stuff that we leave the humans on. And then we've got some like random things that are more like the polyacrylamide gels and some factors in that area that are not really organic substances as much. They're like a little different. So what we choose is going to depend a lot about budget, sometimes what we think caused the lameness or how advanced it is. So it varies a ton individually. There's not really a blanket one size fits all. And just like what we feed them or inject them with Vatiquinone Legend, like sometimes a horse really loves the polyacrylamide gel and responds really well to that, versus maybe one responds really well to this steroid, and we do great there, and it can change a little bit. And then also, if you have a horse who's really obese or has any insulin dysregulation or metabolic concerns or Cushing's, I'm really hesitant to use steroids in them unless I can maybe even prove day of that their insulin is at a normal level. Because there is a risk with steroids of causing laminitis or causing an issue if they're predisposed. Our favorite thing on the market right now is probably the biologics. ProStride has done a great job. There's another similar one called IRAP, which has been around for a while too. ProStride's a little newer. You may have heard something called like alpha-2 macroglobulin or A2M. That one's a little newer, although we don't carry that one, and ProStride has gone and said, look, we have more A2M in our product than A2M does, so, you know, it's not necessarily better. There's something called PRP, which you also get from the blood, and that one is more commonly used in humans than any of those other things I mentioned. In fact, my assistant, I think, is getting PRP in her niece. And then the polyacrylamide gels are things like Noltrex and Arthromin, which you may have heard of. But that's this really high molecular weight, really viscous substance that we can inject into the joint. Kind of incorporates into the synovial lining and the cartilage, but it can kind of help fill in some defects if you have some cartilage issues. And so that one's getting more and more popular in the US. The polyacrylamide gels are not FDA approved. They're in this medical device category. So there's like a little bit more inherent risk in using them, although, knock on wood, they've done a good job, and there's actually a lot of published research on them. It's just FDA takes forever.
So without considering what you're injecting, it seems to me that injections can become very frequent, whereas in humans, I've always heard, don't overdo it because of the negative side of it.
Right. So often, a standard injection in a human is cortisone. Like, that's most often what people are getting, some sort of a steroid. Again, they lag behind the equine research on what we're trying to do to preserve joint health. So just steroid by itself, you're band-aiding the problem a little bit. You're doing very little to improve what's actually going on. And they're also not as worried about, steroids just aren't as dangerous in humans as in horses, so doing that frequently is not a concern. Most of the time for me, if I'm going to inject a joint with arthritis, I'm hoping we get 12 months at a minimum, maybe 18 to 24 months of good improvement. If we have to do it twice a year and a horse is in a lot of heavy use, like, I'm comfortable with that. If we're getting less than 6 months or that 3 to 4 months of response, like, I don't really like this plan anymore. Either we need to do something more, we need to change what we're injecting it with, or realize that we might be looking at retirement from a job sooner than later. So for me, 6 months to 12 months is a lot more standard. Even I have some horses that really only need joint injections over every 2 or 3 years, and it's hard to know which that is. Which ones will last longer, except for all the things I said about, is it more mild, is there less bone change, like, are we treating something on the earlier side rather than the later side, how much work are they in, how much turnout do they get, like, so many factors can contribute.
I'm sorry.
Yeah, I was just gonna say, like, for Rose's example, if I can bring her up, like, so she got a traumatic injury to her stifle. She already had some questionable areas in that we knew about in that same stifle. And so we've been treating a little avulsion fragment that's also affected the ligament in that stifle. But I think over the course of that injury, plus what she already had going on, the arthritis or the synovitis in that joint is kind of aggravating her a little bit. So while she is recovering from another injury right now, our plan before she goes back into consistent work is going to be most likely ProStride, something to go into that joint and cut down any remaining inflammation that's there, and improve the overall quality of that joint for the long term, because she's a young horse and we want her to be healthy and happy for a long time. But we don't want to wait like 6 months and say, she's still off on this leg, let's inject it now. Like, I'd rather do it earlier. And the main reason we're waiting now is because she's been resting for a few weeks, and I'd rather do the joint injection closer to when she's going to be back in work, so we can really evaluate how it's working, and she's not putting a lot of stress on this joint right now.
I was gonna ask about, like, Ollie has had hock injections pretty much annually, I don't know, for 5 years-ish, 4 years. And we've always done, I think it's the hyaluronic acid, is it?
No, we use steroids.
Steroids.
But
Is there a
you
benefit?
guys do hyaluronic acid and steroids.
Yeah. And is there a benefit to shifting him to ProStride, or is he too advanced?
Yeah, that's fair. If he's starting to fuse, not to say that ProStride wouldn't still help, but probably you're going to see a little bit more clear response to a steroid, like, honestly, yeah, especially if he's starting to show a little bit of fusion at this point.
And he's 17.
Yeah, right. So, like, it wouldn't necessarily be wrong to try it, but from a cost to benefit ratio, you might be better off with steroids at this point, especially those lower hock joints. Which again, I'm much less worried about causing a little degradation in hock cartilage because they could become more comfortable if the cartilage goes away rather than less at some point. Yeah. So,
Thank you.
I think Whimsy we ended up doing
Whimsy did
post-riot, right? This is just kind of a different case, and we were doing joints that we were injecting. So,
Yeah,
yeah,
yeah, you put a little in that one that she had the bone chip.
that's right.
Yeah,
That's right.
the pasture.
Yeah. In hocks, doing steroid by itself is often a very cost-effective way to do it. Adding the HA, the hyaluronic acid, in a joint that is low motion and kind of fusing is probably not as useful as in a high motion joint where we really want that lubrication and some of that stuff. So,
So you won't
and-
always.
yeah, you don't necessarily always. Or if the joint space is just getting really tight, sometimes, because it's getting narrower and a little smaller, sometimes you can get your steroid in fairly easily because it's much thinner, but that thick HA, you try to squish and it just comes out onto the horse's skin, and that's not as useful. So there's reasons to not do as much there. And hocks are one of those joints that we do our best to get our needle in right here, but the joint space in a hock, like that's actually probably a pretty good approximation of a stifle and how much space you have. In your hock, you've got these like kind of rectangular bones, and that joint space might be the size of a credit card, or smaller if there's like bone spurs and everything, making it a little more narrow. So sometimes our needle gets maybe here, and it's really close to the joint, and that steroid is going to diffuse and kind of treat everything, versus that really thick HA. If it's bled under the skin right here, it's probably not going to do that much. And there have been studies with that showing, 50 to 70% of those hock injections actually get the needle within the joint. The rest are periarticular, which is the same way we do SI injections. I know, don't you love hearing that? You're getting roasted here, but
Yeah. It's being absorbed into the skin.
Yeah. But the thing about steroid is it's so thin, the steroid is going to treat like this much of the area, right? So you don't actually really have to get it right in there because it's just diffusing. HA, a little less likely. Really lovely to get joint fluid out when you're doing hocks because yes, I'm right there.
Mm-hmm.
Or there's other ways to do like, hey, let's do ultrasound guided or X-ray guided if I'm, worried about it. I actually hate injecting hocks and don't do it a ton anymore, but I think a lot of times hocks are the go-to. They're a little stiff, let's just inject it, and really it might be something else. But certainly it is a source of pain too.
Well, and I think we did it after an X-ray, so she
Knew exactly what they were
there was
looking at,
something there, so
Yeah.
that's probably a little higher likelihood, but yeah.
Does the ProStride actually, like, I know you're taking the blood and processing it, does it like, stimulate the joint to make more HA, or is it more just like the proteins?
Yeah, so what ProStride is a combination of proteins that stop the inflammatory cascade, so like IRAP, which is interleukin-1 receptor antagonist protein, which goes and blocks the interleukin-1 receptor, so now it can't like stimulate this cascade of inflammatory, so it stops that.
Okay.
But it also deposits a bunch of like healing growth factors into the joint.
Okay.
So what it will do is work on the synovium and make it much healthier. So then the synovium produces more hyaluronic acid and the other stuff you want. It's really just letting this do its job. Most of what we do in medicine is just trying to get out of the body's way so it can heal itself, right? I don't really heal anything. I just try to help the body heal. Thank you guys. Thanks for
Thank you. Yeah.